Are there any new people, seriously? Oh, not very many, just a few of you. Well, for those of you who have never heard Dr. Nasr before, he is an MD, specialized, he's an internist and a cardiologist, but before he was a doctor, he had a PhD in biochemistry. And that's why his approach to health and making people feel better and helping them regain their health is so much different than traditional medicine. He is absolutely the most brilliant person that I ever met. And if any of you have an idea for a program that you feel he should discuss, please tell us about it, because the program tonight is the result of being cornered by a few people at a convention saying, she had never talked about male menopause, and I looked at her like this. So that's why we have this program, and we're always open to your suggestions. He's been coming here since 1986, so this is a long time, and we've covered an awful lot of various programs. So may I please introduce to you the most brilliant man I know and the best doctor I know, Dr. Mohamed.
Thank you very much. Colleen, the least didn't work. Okay. You know, in medicine, you learn how to adapt to any situation. I come here and I find no microphone. That reminded me one time when I was making rounds in Chicago Medical School at the Navy, Great Lake Navy Hospital, and I was making rounds with my cardiology fellows, and then I was passing by a bed, and I saw lots of students around it, and I find a young man who was vomiting blood, and blood was coming from his mouth just like a hose, and immediately, as a chief resident in internal medicine or cardiology, I really don't want to interfere with the surgical team, but in the meantime, I know I was better than them in handling emergency situation because I was in Cook County and other big institutions, you know, when you get stabbed wound every 5 minutes. So anyway, then I told him, why don't you intubate the guy? You know, he's going to suffocate blood, he's going to inhale the blood, he's going to intubate. He said, we can't intubate because this is not working, this is not working. So anyway, to make a long story, we have to adapt regular hoses to put in the lung and one in the this and put air here and air here, and this is a big center. Their budget is over $32 million, but they spend it in other things except the medicine. So in any way, that day we had to use actually air gauge inflator to measure the pressure. I had to measure the pressure in the stomach, air tire thing, you know, to put air and maintain my pressure so I stopped the blood without blowing the lung. And anyway, he made it, you know, otherwise he would have died that day. And then a couple days later, of course, the nurse gave him the wrong medicine and he died from it. So in any way, that happens in medicine. And that's this is a statement I make like that on a video, naming my center. That it means I'm challenging them to bring it out into the public and discuss it with people, because that case I requested investigation from Washington, and I was told if I am not quiet, I'm going to get fired or transferred. And then I resigned, you know, after that right away. So in any way, I just want to tell you that this is adaptation here is part of life. I have friends here from New Jersey. Welcome. I was told to ask to speak about female hormones, which we had a lecture on it before. And during the discussion, I said to Joyce, I think we should talk about both male and female hormones in this lecture, because I have no difficulty correcting female hormones. I have over 13,000 female patients in my practice, and all of them, their hormones are doing fine. We correct them. My problem is with men, you know, because they have hormonal problems, and they just want to admit it, and they think they're perfect. They think there's nothing. can go wrong with him when I try to discuss it with him. Hey, listen, could it be this, your hormone? No, I'm fine. Could it be? No, I'm fine. Until the wife comes in, I said, where's your husband? He said, he's dead. And then that is the common thing. Either he had a stroke or he did, because men, the reason they die 10 years younger than women is because they really have problems and they just don't want to admit it or take care of it. It wouldn't be wonderful if they can be human and then listen that they are vulnerable to disease like everybody else, and they can be perfect in their health like everybody else. And this is the reason we injected right here the male problem that we see in the practice. Of course, there is none of my male patients resist my discussion with them, because I'm very gentle. I discuss it in a scientific way with every man. But to get them to come and sit with me, I have to bribe them with something to get them to come and listen. Even some of them, I tell you, I pay for your visit, and I give you free medication. I do the test for free. Would you come? I said, no, I'm busy. I have friends I do that to. I said, please come. I do it for you, So that is the problem. The problem is, if we know how God made the human body and how simple it is to keep it healthy to over the age of 100, easy, we can enjoy this living. There are two major functions for us on this earth. One is to be here and enjoy living, enjoy everything, all the faculties God gave us to enjoy. The second is to worship the God who gave us this body to enjoy. And the problem here, we have abused that machine we got so much, and we expect the doctor to have the miracle answer each time. You follow me or no? Every time you want to have a problem, fix it. I got the money, fix it. I got the insurance, fix it. Who do you think he is? The doctor who is treating you, he is sick himself. He either smoking cigarettes or alcoholic or having a problem or taking drugs, and he never touched your good food, only eat junk. So it's a blind leading a blind. So what we have done, I have done over the last 20 years, I start to take medicine to a different level. The level called I am in right now is good clinical medicine. Good clinical medicine, there's nothing wrong with that, being a good doctor, but use nutrition as part of the management of that patient. Are you following me? This is important, because what I hear when I used to make rounds with my professors, when a patient opened their mind about anything, nutrition, he was told, no, like, shut up, you don't know what you're talking about, it's all in your head. Things like that was bothering me when I was in training, because when I was in training, I already finished my PhD in biochemistry. I was a professor before I was a medical student, but they didn't know that. And when I listened to that conversation, I said, okay, when I get to practice, I'm not going to do it that way. Then I started practicing what we call prevention. What does preventive medicine mean? We talk about the hormones also. This is something you have to understand in your head. The human body lives approximately 100 years. From the year 1 to the year 100, there are diseases developing inside the body. You understand that? There are diseases. Everybody develops disease. Are you following me or no? Everybody gets sick. Nobody is perfect. Everybody gets sick. The disease started developing in this part of your conscious right here. It's called the unconscious part of you. Means you don't know you have it. Are you following me or no? You have actually signs of the disease in you, but you have no symptoms of it. What is the difference between a sign and a symptom? A sign that anybody can see on you something is wrong with you. Symptom, you don't know you have it or you deny it. Somebody tell you, you look terrible, so no, I feel fine. Somebody said you look depressed, no, I feel good. Well, actually, the person who's watching you is correct and you're wrong. Because the sign is what everybody can see, include physicians or laboratory tests. So sign. Once the diseases start going to symptoms, these are the symptoms right here, then you feel it. It can come at the age of 20, 30, 40, 50, 60, 70, then you start having problem after problem. This problem you're having, it didn't happen overnight. It took 10 years or 5 to 10 years to develop. You understand that or not? And then you question, how do I find out? How do I find out what's wrong with me? Then you go to a doctor. He does a physical. Well, the physical, he depends on the sign, what he can see. But there is another level called the molecular level, the cellular level. You know what's the molecular cellular level? He cannot see that. So he has to check your cells to see are they getting sick or not. Are they having immune problem or not? Are they developing lupus or not? Are they developing arthritis or not? Are they developing cancer or not? Are they getting clogged or not? Are they getting poisoned or not? He cannot see that. He has to do tests for that. The test he can do, it depends on his knowledge. And if he doesn't know what to do. And that's another problem, lack of knowledge among our general practitioners and internists lead them to say to you when you have a headache or a problem, oh, there's nothing wrong. There's no problem. That's all stress. Have you heard of this before? Have you heard people telling you that before? No, there is no way that your body can tell you something here that's not important. There is no alarm your body can give you is not serious. Are you following me or no? Even take a little cramp from a cold. Just give you a cramp. That is serious to the body. A little flu in the ear. That is serious to the body. Are you following me? The body knows it is serious. It gives you alarm. It tell you the earache is terrible. It can go to the brain and you can have meningitis. Take care of it. The sore throat. You can have rheumatic fever. Take care of me. The chest pain, it could be a heart attack, take care of me. The cough, it could be a virus or a cold or pneumonia, take care of me. And so on. The body communicates with you with a bunch of feelings. Cough, headache, blurred vision, dizziness, fatigue, tiredness, aches, pains, it tells you. And when you start ignoring every one of them, the body shuts the alarm. The alarm doesn't last forever. Are you following me? Because that alarm is going to be used for something else. So the alarm will go on. A guy who has a chest pain, could be a heart attack, he gets to the alarm for a couple days. After that, the alarm shuts off because the body has to detect other organs also using the same telephone line. Then you don't have any more symptoms, but you have the disease. So right here is the general feeling you got to know. You have to find your problems in this before it goes to this. Once it goes to that, many times it is what? It is too late. Many times it is too late. How many times in your life you told somebody, take care of yourself, eat right. They don't eat right, they develop cancer. They have your blood pressure checked, they don't, they have a stroke, right? You heard all of this. Because the person doesn't take care of themselves here, then he pays the price here. I decided to, when I want to talk about the hormones today, to tell you something about the human body. The human body is made of organs, as you all know. The majority of people right here are either my patients or my friends. I know almost everybody in this room except a few. So you've seen that before. The human body is made of organs, made of a bone that's supposed to make what? Blood cells and take care of the immune system. And also, the body is covered with tissue right here called the skin. And that is the most important organ, as we said in many lectures before. In the Western world, most important is your skin, because people will treat you according to your skin. If it looks old, you don't get the job. If it looks young, you get the job. If it looks black, you might not get it. If it looks white, people have fixation on the looks. Where when you study civilization like ours in Egypt for 7,000 years in my village, we lived there for 7,000 years, we never used birth date. Never. Birth date has never been mentioned. And we survived 7,000. You go on the pyramid, show me one birth date on the pyramid. Because they believe that you are treated according to how much you can function. You can be 20 and act like 100. You can be 100 and act like 20. Then that's fine. You are treated according up to you. Age is man-made figure to classify people. You know, young or older one. But actually, age is important to study diseases. It's true, but we blow it. As a matter of fact, we never had a birthday celebration. Because it's true, you celebrate your birthday, you get gifts and all of that, but after the age of 50, you don't want to remember the day. Right or wrong? Okay. So the first 20 years, you're happy. The last 40 years of life, you remember you are 70. You remember you are 69. Next year you are 70. You remember you're 80. You know, gosh, you know, who likes to be depressed all the time? Remind you by how old are you? And that is the way we are. We treat people according to the skin. When I'm in the hospital, and we have nurses right here, they can say the same thing. When we look at people coming for emergency, we determine who to get help right away according to the way they look. We did. We don't admit it. But if that is a young man, good looking, all the nurses after him to help him. If it's an older person, put him aside in the corner. I've seen that. And if he is a black person, even driving a Rolls Royce and wealthy, just put him aside. He writes his name in the end. And if it's a woman, she puts aside. A man treated first. If it's an older woman, even worse. Maybe they remember her 5 days later in the chair someplace. These I've seen. They deny it, but we've seen it, and my friends, the doctor and nurses, know it. You know, they sit among each other, here comes this, here comes that, and they call them names. So that is a sad part about the skin. Let us keep the skin young, because that is so important in this society. We can't afford to get it old anymore. Okay. The third organ right here, one organ some people don't have, and that is the brain. And that organ also have a function. What does it do? This is, I'm going to give it a square right here, because this is the organ we're going to concentrate on tonight. The brain, because that's where the hormone message is coming out of. The brain, that's what controls all your pleasures. The taste, the smell, the food, the romance, everything controlled by the brain. So that one here also have functions. It sends nerves and hormones out. So we're going to have to check that both of the nerves and hormones control. They work together, and today we're going to be talking about hormone, because if we're going to talk hormone imbalance, it doesn't mean just to go ahead and take a hormone. No, you got to have the right brain to send the right hormone also to the body. We cannot keep taking drugs from outside. We have to force the brain to manufacture the right hormone if it can. And that can be done through what we're going to be talking about today, about hormones. This body has other organs in it. Has the lung right here that's supposed to get oxygen, get rid of waste. It has the liver that it detoxifies the body and makes amino acids and makes hormones also. It has the pancreas that it makes hormones. It has the kidneys that eliminate waste. It has the heart that pumps blood all over the body. So the body is made of a bunch of organs. They need to work. Each one does something. The bone has to make blood, so we need it for energy. It has to make immune system to defend against viruses and cancer. The skin has to have enough circulation so we stay warm and it doesn't develop cancer. The brain has to function properly so we can see, hear, and memorize things without losing memory. The lung has to breathe oxygen and get rid of chemicals, and so on and so on. How are these organs work? Each one of those organs made of a cell, bunch of cells. Those cells receive nutrients through what? Through the bloodstream that brings nutrients to the organs. The nutrients, we talked about it in many lectures. They are the protein, the carbohydrate, the fat, the vitamins, the water, the mineral, and what else? The oxygen. Those nutrients, they go inside and they produce energy and produce hormones and produce enzymes and also get rid of poison or waste. This is how all these organs work. Very, very simple. None of this can work unless there is a hormone takes them inside. You need a hormone. So what is the definition of a hormone? Hormone is a protein that facilitates food to produce what? Energy, hormones, and enzymes, other hormones. So what is the definition of a hormone? It's a substance in the bloodstream. Without it, you die. Without a hormone, you die. If we go ahead and take one gland out of the body will die within a week. But certain glands compensate for other glands. And those glands can do only up to limit before they also give up. Just in case of the ovary, as an organ, if you take it out, you don't die. Within a week, of course. But the adrenal helps the ovary for a while until the adrenal runs out of estrogen, then the person themselves age fast and die. But so if we want to study hormones, let us look at the human body again and see in a different color where are those hormones are located. The first hormone, the first gland, is located where? Before that even. Before the pituitary, above it is the hypothalamus, and above that is the thalamus gland. The mother gland is the thalamus gland. That is the main gland born with a baby to control everything. The thalamus gland controls little glands underneath it as systems. One of them is the pituitary gland underneath it right here. But the reason we're talking about that because the thalamus controls more than the pituitary gland. The pituitary gland is the computer inside the brain that reads your feeling, your condition, your status, your life, and adapts to it every single minute. That is the pituitary gland. How does it do that? Through all the sensation it gets. The vision, the hearing, the touches, the sound, the noise, the messages come to it from the body, or outside of the body. Interprets and releases response. The response for whose benefit? For you. You understand or not? So whatever problem comes, it responds to it. Let us say there is a lot of noise, that it responds. It tells the heart and tells the other organs do something against it. If it is too cold, it responds by making the skin white so the blood does not go out and conserve the heat for the organs inside. Then you get a chill, that's okay, but it tells you get a chill so you can get covered. That gland controls everything, controls your thinking, your memory, your dreams, controlled by that. Even a dream, a simple dream, just like even if you have a problem, you see the whole family get burned in an accident in a car. That gland saw that. It's preparing you for next day. How does it do that? It creates all kinds of dreams to put all the memories in a memory bank and push it down, hide it from you. So next day you might not remember it. In a month you might not remember anything. It blocks it completely from you. That gland is our friend. So that is the thalamus gland and the pituitary gland. Inside the body right here down, there are the worker glands. The gland is supposed to produce hormones. These glands here do not produce hormones. They produce telephone messages. They send messages only. Electricity. For example, they will send a message to the thyroid gland in the neck to tell the thyroid gland, that person is overweight. I want you to make more thyroid hormone to burn that fat. Because the pituitary gland got a message from the heart telling them, I got too much grease floating around me here, you better tell somebody to get rid of it. Then it tells us, secrete thyroid hormone. Or the person is cold, needs heat. It tells us secrete thyroid hormone to get more energy. So without a thyroid, you will gain weight, you will get tired, your heart will slow down, you get fatigued, you gain weight, you retain fluid, and then many other problems associated with that, hair loss and everything, associated with the thyroid gland. So, and you cannot depend on thyroid function by a blood test or the temperature under the arm. How do I depend on? By the patient themselves. What are they telling me? Are they tired? Are they gaining weight? Are they retaining fluid? Are they have that? Then they must have something wrong also in their thyroid. You understand that? Blood test, if it's abnormal, yes, we use it. If it is normal, we ignore it. Because we have to listen to the patient first, then the test second. The pituitary gland will send the message to that thyroid to do all of that. If the thyroid is hyperactive, you lose weight. If the thyroid is we don't have that problem. If the thyroid is underactive, then we have problems. Problem with vision, memory, balance, sleep, constipation, slow heart, skipping, tired, fatigue, cold skin, cold hands. You name it, that's all related to the thyroid. And the blood test might not be accurate also. So what we have to do with is the person, not the test. That is one gland. This pituitary gland also sends another message to the gland behind it in the back of the thyroid gland. In the back right here of the thyroid gland, there are 4 glands called what? The parathyroid glands. They secrete parathyroid hormone. What do? That's another hormone, another problem. Believe me, any of the glands we're going to mention, I know everybody come today have sexual fixation, what he's going to do to solve all my sexual problems, men or women. No, they're all related. If the thyroid is not working right, the others are not working right. So don't rush me to get you to the end right here because you have to pay attention to the basics first. Okay. Yeah, I got calls about that, on the phone. Are you going to be talking about that? Yes, I will. Okay. The parathyroid hormone is the hormone that does what? Anybody knows right here what does it do? It puts the calcium in the bone. It boosts the calcium in the bone. With the estrogen, we'll come to that later on. It boosts the calcium in the bone. So without that hormone, you're going to have weak bone, with fragile bone. So we better be sure that the parathyroid hormone is normal. And how do we do that? How do we do that? By exercises. All this gland, parathyroid needs is lots of exercise and take calcium and alfalfa. Alfalfa has vitamin D, vitamin K, and calcium has the calcium and the magnesium, and both of them together, with the hormone, it will go in the bone. So if we're going to build a bone cell, we need a hormone called what? Parathyroid hormone, and another hormone called estrogen, to put the calcium inside the cell. That's the bone cell, then inside the cell. We move down to other glands. The next gland we're going to be talking about right here is the adrenal gland. The adrenal gland located above the kidney in the back right here. And adrenal glands, they make what? They make adrenaline. Isn't it amazing? Thyroid gland makes thyroid, adrenal gland makes adrenaline. Medicine is very easy if you think about it, okay? But you have to go to a doctor to tell you that. You cannot think about that yourself. Adrenal gland makes adrenaline. What does adrenaline do? Give you energy. So adrenaline is another hormone we need for energy. And let us say I'm going to wake up this morning and I have to prepare a class because I'm a teacher. I need adrenaline to get my brain to work. Or I'm a farmer. I need to get in the field to fix things. I need adrenaline to give me the energy, right or wrong. Or I am accountant, or I am whatever job, you need adrenaline. Adrenaline is the happy hormone. It's the hormone that it's a euphoric, like cocaine. Actually, adrenaline is a cocaine family. And that's why drug addicts, they like cocaine for. Because it gives them the same feeling of adrenaline. Because adrenaline, if you look at the name, is A-D-R-I-L-I-N-E. And cocaine, C-O-C-A-I-N-E. They both have I-N-E. Means they both alkaloids, and they both gonna produce the same result. So anything with I-N-E in the end, cocaine, adrenaline, nicotine, N-O-C-C-I-N-E, cigarettes will do the same. Or amphetamine. Amphetamine have I-N-E, will do the same. So not because man was able to manipulate the body and produce toxic drugs similar to ours is good, they're never as good. And people who listen to that, they pay the price. We call those the drug addicts, and they pay the price eventually. So adrenal gland makes adrenaline. And this gland to make adrenaline, the pituitary gland has to send a message to it to tell it to make adrenaline. So if the brain is not working right, and if the brain itself is not working right, The thalamus is not working, the pituitary is not working, the whole body is not working. This is why we say stress, external or internal, eventually affects the whole body because everything shuts down underneath it. So this is why the last lecture we gave here, how many people were here in the last lecture? Okay. And you remember the last lecture we said about how much nutrition is related to stress and hormones and all of that. We talked about that, and exercise. Today we're saying that stress does affect your hormones. One of the most dangerous hormones we're missing right now, living in this fast life, is another hormone out of the adrenal gland called what? That hormone called cortisol. Cortisol. That is one of the biggest hormones I have a problem with. Cortisol is a steroid. Your body makes the steroids every day. At 3 o'clock in the morning when you sleep, you're supposed to wake up at 5, the body starts producing steroids. By 6 o'clock, the steroid amount was so high in your system, and you know steroids cause water retention, your blood pressure has gone up so much that you have to wake up, because if you stay in bed, you're going to have a headache. You know, if you oversleep, you can have a headache. Then the body is forcing you to get up, and you get up warm, not cold, and fresh, and clear head, and singing in the shower, and doing all of these things because the cortisol is working. And that is another hormone I find lots of people with fatigue is missing. Adrenal insufficiency. Adrenal gland is not working right. I remember when I was in internal medicine, there was a question in my board exam, internal medicine board. It says, adrenal insufficiency, chronic adrenal insufficiency. You know what the word chronic means? It means people have it for a long time. How often does it exist? Never, sometimes, or all the time. And the answer, they want me to say never. The adrenal never gets exhausted. And that is completely wrong, because the newest publication right now from New England Journal of Medicine this year countering the previous belief. We have people who is walking with adrenal gland is not functioning. Believe me, do not rush out of here and go to the health food store or your health magazine and take that little bottle called adrenal stimulation or adrenal formula or adrenal supplement. Have you ever seen that stuff in the magazine? I'm sure you have. All nothing but garbage. All bunch of little few brands and talcum powder put in tablets to make you think your adrenal is going to benefit. And biofeedback, by thinking you feel good for a few days, but actually it doesn't work. There is no supplement in the market called adrenal, will help the adrenal gland. There's none. The only thing will help it is what we're going to be talking about, like we did last time. The nutrition, the exercise, the rest, and if it's diseased, kill whatever infection is inside it. Simple, and I don't know why simple medicine becomes complicated medicine all of a sudden, but adrenal gland is not difficult to treat. As a matter of fact, I think I'm treating a patient right now. I think maybe she's in the room here someplace. I think maybe she has complete adrenal insufficiency, adrenal gland shut down completely. I think 3-4 years she have it, I think from this area here. And we working near her to try to bring that adrenal gland back after it's been dead for 3-4 years. This is the 3rd week or 4th week for her to me, and I think the adrenal gland is coming back already. Because I believe in the human body. I believe in the miracle God put in that body. I do believe in it. I do believe, give it what it wants and be patient, it probably give you a response. That is the adrenal gland. Here is what happens. Cortisone, steroids, suppresses the immune system. Cortisol, when you have too much steroids, shocks to the immune system. But in the meantime, God put the immune system and the cortisol in certain levels to work with each other. Under stress, your brain produces something called, maybe we need another guy. This is getting to be complicated here. Let's draw another picture. This looks better right here. This is the adrenal gland right now. Okay, now. The brain produces a stimulant called ACTH. Every morning at 2, 3 o'clock in the morning, the brain pulls out ACTH in the bloodstream. Adrenal stimulating hormone. Forget about the ACT and all of that. Adrenocorticotropin hormone, but let's make adrenal stimulating hormone. And that message comes and makes the adrenal secrete what? Cortisol and what else did we say? I forgot. Adrenaline. It secretes both of them. Adrenaline, that's a euphoric drug, makes you feel good. And cortisol, that's a healing drug. Whatever damage happened from the day before, it heals it. Heart attacks, it suture it back. Cuts, suture it back. Broken bone, it fix it back. You know, whatever it is, it goes and suture. That's what the steroid does, cortisol does. Not the steroid the athletes use. Not the same kind the athletes use. But we need some steroids on our own. When this stimulation happens all the time, because the person is not getting enough sleep, so it's pumping all the time, ACTH, what happened here, the adrenal shut down. It gets exhausted from no more adrenaline, no more what? Cortisol. That's called adrenal insufficiency. And what happened? The person started having memory problem, dizziness, fatigue, cold temperature, the same like the thyroid. All glands have almost the same symptoms. They all have the same thing. They all do very similar functions to each other. And that is the adrenal insufficiency. Adrenal insufficiency will lead to cancer, will lead to allergy, will lead to infections, will lead to depression. Depression is caused by adrenal problem. 99% of depression is from a hormonal problem. It is not because you want to be depressed. It is because your body ran out of things make you feel good. And then when we give the body dopamine to get rid of depression and give energy, dopamine, that's a substance we give. Dope, amine means like nicotine, like like the other stuff we talked about. It makes you feel good for a while. These are the imipramine, all the antidepressants you hear about. The antidepressants, but they do help. But up to limit. Again, you like to have the main gland start active again, produces enough cortisol, enough adrenaline to help the body to get happy. Not depending on the antidepressants all the time. However, we do give antidepressants for a period of time until this gland starts recovering. Because one of the biggest problems in depression, the brain is going 150 miles an hour all the time. It's going on and on and on and on. There's no rest. When it doesn't rest, it gets exhausted also, and the person goes crazy. He can see things, takes a gun and shoots everybody around, or he takes this and shoots everybody. All these crazy people you hear about taking something, if they don't have drugs, it is because they have problem in their brain exhaustion, either from stress or a chemical induced, most likely stress related. And what we do in a hospital when we get a crazy guy like this coming, we give him a drug, put him to sleep for 3-4 days, and feed him until his brain slows down, recover, and he comes out, he doesn't remember ever he did anything wrong. One time I had a doctor, a friend of mine, come to the emergency room, and he doesn't even know who he is. And then he's a psychiatrist even. And he was on and on and on and on in the hospital, day and night, day and night. He loved his patients. His name is Dr. Williams. And I love him because he always goes out to help people, but his brain couldn't take it anymore, and he comes in, and he mumbles, and he doesn't know who he is, he doesn't know where he is. And then I told the nurse, put Dr. Williams in the chair right here, we're going to tie him down, and then I'm going to give him some Valium, put him to sleep for a couple days, and let's see what's going to happen to him. And he wake up after 24 hours, 48 hours, he doesn't even remember he did it. Because his brain was exhausted, his adrenal was exhausted. And that's all we have done for him, is to get him back with good nutrition, of course. This is the adrenal gland we talked about right now. Now we're going to talk about other glands related to sexual functions. These are the two glands right here and two right here, not in the same person, of course. Okay, these glands are the ovary and the testicles. Ovaries in women and testicles in men. Both glands get stimulated by two hormones from the brain, one called FSH, another called LH. Let us draw another picture, complete brand new for those two organs, and let us take one at a time. Let's first talk about the male hormone problem, then we'll talk about the female hormone problem. The male have an organ, a gland called testicles. It gets a message from the brain, FSH, and LH hormone at an early age. When does this gland get an early age? Actually, the baby starts producing sperms at the age 8 months inside his mother, before he was born. And the girl produces eggs at the age of 8 months inside her mother, before even she comes out. She has that. It's all decided. The male and female decided before they come out. And even those sperms are not mature, and those eggs are not mature, if we take them out and mature them in an incubator, it will produce a child. So the species of human race is being preserved before birth. The cycle continues. So for people who think that to maintain the human race, to propagate the main message we're going to do it, is by a man marrying a man, a woman marrying a woman, you are wrong, because your main function in life is to produce. That's, you like it or not. Animals do it, plants does it, and that is the way. This is why everybody homosexual, it's his own right. His own right to do whatever he wants. But the main function he has to have, he has to attempt to find the opposite sex and marry and produce somebody hopefully better than him. Because we human beings, every one of us, we want to have a child grow better than us. Isn't it true or not? We work hard for that. We want them better than us, mother or father. But imagine if the whole human race refused to do that, then what are we going to have? new generation. So this is the first step. Function comes from pituitary gland. And also it's involuntary. So homosexuality is not inherited. It is acquired. Absolutely acquired. If it is inherited, then we will not see FSH, we will not see LH, we will not see estrogen, we will not see progesterone, we will not see testosterone at all. If we see the hormones, then we have to divide the sexes. Are you following me or not? That is the way it is. But the psychological problem a person have a desire to somebody or this, that is a feeling people develop towards each other. Maybe somebody likes them, like in Egypt. You know, when I used to walk in the streets in Cairo with my brothers, or my father, I always have to hold his hand in my hand. Even in the older age, all the brothers holding their hand. It doesn't mean they're homosexuals, but there is a love connection between friends to do that. Or a girl with a girl hugging each other and walking. It doesn't mean anything at all. Just means they love each other. That's okay. Love is great. But we're talking about reproduction here. Reproduction is, we divide it to either producing testosterone and sperm or producing female hormones. This hormone comes to the testicle and produces a hormone called what? Testosterone. And the testosterone hormone is a male hormone. And the boy just being born a little boy, until the age of 13 or 12, we don't really know. He doesn't look like a boy. He has the same muscle like the girl, and the girl looks like a boy, the same structure actually, until a certain age they separate from each other. The hormone starts doing something to the boy. What's the function of the testosterone hormone? Number one, the gonads, which are the testicle, has to get enlarged. That is the testicle and the organ, the penis with it, has to get enlarged. Because there is no way this sperm is going to be delivered by immaculate conception. It's not going to fly and go there. It has to be delivered mechanically there. Okay, so God knows that. And animals and everybody. That is part of life. It has to be done that way. To do that, the gonad has to be healthy. Number two, the circulation in it has to be also healthy in that area. Number three, the testosterone does what? And watch that also in animals. Male lions, any males. It produces tremendous amount of muscles. Because the function of testosterone is all muscle related. However, testosterone itself, even if it is involved in the mechanical part of a male, it has nothing to do, not much to do with the feeling, the libido, the feeling he wants to look for a female. Has nothing to do with that. The other hormone has to do with that is ACTH, cortisol, adrenaline, and thyroid, and believe it or not, men produces estrogen and progesterone, female hormones also, for the libido effect. Libido effect comes from all these other glands. So the two parts right here for a male. He can produce sperm, he can produce testosterone, he can have the muscle, but if he does not have the libido, he is not going to have the erection, he is not going to deliver what he had produced. So these other glands come in function for that. One of the most important glands in this one right here is the adrenal gland itself. Because that is what controls the valves. The valve inside the circulation of the penis. The valve has to close, the blood keeps coming, the valve is closed, erection occurs, sex is done, the message has been delivered, and then go back, revert to cycle number 1 again. And that's the way we are made. So impotency, it is not psychological. Impotency, it is not psychological. Impotency is a hormonal related, circulation related. It is not psychological. We proved that. We can give medication to a patient. We can give Yohambin, for example. That's one of the medication we give. It's a natural herb to a man. Regardless if he likes it or not, he will have erection. Or Deseril. Certain drugs will do that. Will shut the valve. But they're dangerous if we don't control it. Because if the person has priapism, and priapism means erection, and it doesn't open, doesn't shut, he will have gangrene in the penis, and he will have infection. So we have to control it in the right way, and we have him come to the hospital with penis almost gangrenous because he's taken the drug, and the doctor didn't know the side effects of the drug. You know, and we have to inject something to release the pressure from that person. So the reason we put that part in our lecture tonight is because the following. Because men, when they go through the middle age, between the age of 40 and above, they start having problems producing some of these hormones. And they start having problems with the circulation. And they start having problems with the testicle itself. As a matter of fact, if you study the circulation inside this organ called testicle, you'll find something very important God put in there. The temperature inside the testicle is 120 degrees. 120 degrees inside this testicle. So what did God do? He let it hang out of the body for what? Radiation, to get air to cool down. If that testicle pushed inside the body, as a baby is born, and the testicle did not descend, what do? We do surgery immediately to get it out. Because all we have to do a couple of days, it's all burned. You understand? And that, if we have to do, as I said, we don't see it, we have to open up and get it out, to air it. And here, look what we have done. The tight underwear and the tight jeans, what have they done to our male? We have the following. 99% of the sperm I have analyzed for men who wear tight jeans have 70% of their sperms dead. They're lucky even to get anybody pregnant. 70%. You look under the microscope, you find all these poor guys drunk and they smother, they go in here, they're hot, they're not healthy looking, and they said, oh, no wonder. Then we tell them, okay, change your method, change your way, get looser underwear and do all of that, and within a year, they come back to normal again, and then they have children, they have no problem. So this is something you've got to understand for men and boys. If you have boys, don't encourage them to wear tight underwear and tight jeans. Even if it is convenient for them, protect it. Get a space that much underneath that. You understand that or not? This is not for you. It's for those new generation after us that they might not produce anything if we continue that way. So that is one part about the fertility itself is a problem. Not only the fertility is a problem, the kind of a sperm comes out, which is supposed to have a head like this with the chromosomes inside it, It has a motor behind it to move it inside his wife, and it has a tail. If the motor fails, he can take the rest of the distance swimming, and then he has a hat, so he can take it off and say hello to the ovary before he goes inside it. All of these things right here, when you look at it under the microscope from tomatoes we see nowadays, here's what we see. We see the acrosome, which is the thing, the hat he has under it, the vitamin C. So when it hits the egg, it dissolves, and the vitamin C is acid. It makes a hole so he can go in. That's why I say hat. It's nothing to do with hat. There's no sun over there. But in any way, that is we don't see that. Not only that, you look at the chromosomes are okay. You know, we check the chromosomes, they're fine. There's no problem there. We look at the motor. It's all crumbled. We look at the tail. It's like this. I swear I've seen the tail is around his head. So where are you going? It's that way. It's not that way. And the lady said, "Where's my husband?" I said, "Well, I think you should look for another one." Anyway, this is the problem. For men, the impotency is a problem hormonal related, circulation related. It is not psychological related like some people believe, oh, it's your wife, it's your stress, it's your head. No, it is organic related. And it has to be controlled. Maybe stress has something to do with it, you know, but it's definitely, we have to check the testosterone because men over the age of 50, 99% of them, I find problem with their hormones, testosterone. But we got another problem with men we have to think about. Even if he have a healthy testicle, there is another trip that sperm has to go through, another gate, that it has a problem. And we have to also take care of that. When it comes out like this, all the sperms comes out like this, and they travel, they go through from the testicle, they go out, actually, and they go in the groin first, and they come back in the abdomen, and they come out again through the penis. They don't go straight to the penis. That's right. They don't go straight. They go from the testicle, they go through the groin, called the spermatic cord. That's why when you have a hernia, then they go about the bladder, then they enter the bladder, enter the prostate, and then that's how they come out. So we have another problem right here we have to deal with them, and that's also related to impotency. This is the trip they take before they come out. Right here in the bladder area, there is a gland called what? Prostate. And the prostate, there are two problems occur in prostate. Prostate secretes the liquid, the mucus liquid, to make it easy for the sperm to travel. Also secretes the nutrients for the sperm to eat in the way. He's going to take a long trip from the moment he leaves right here to reach the egg way over there. He's traveling about 2 feet. For a guy like that traveling 2 feet, just like you, I'm asking you to walk to Africa. You need food with you. So what God has done, He secreted food along the way to him. One of them is this one, he secretes the bioflavonoids, the vitamin C, everything comes out with it. And also secretes tremendous amount of vitamin E with it, just in case if there are radiation around the area to protect the sperm from radiation and chemical and germs and yeast, so they don't attack them and eat them. So he is actually encapsulated all the way. This prostate, when we have When we have children grown in a society that we teach them from a young age to have a girlfriend, to have sex with her, we have abused the prostate of that child. Is that happening or no? You all deny it, but you don't. Because if your son at the age of certain age doesn't have a girlfriend, you find him one. That's his girlfriend. Right or wrong? We encourage that from young age. So what you're doing by the age of 12, their glands already maturing. What do you think they're going to do? They're going to have excitation towards each other. And because our religions prohibit that, they inhibit it as much as possible. But some of them can't inhibit it anymore. Then what they do, either they go ejaculating all the time, or they go with girls, and then we have premature sex all the time, and there is infection coming in and exhaustion right here. So by the age of 40, the prostate dried up. Or disease, swollen prostate. You understand what I'm trying to inject right here. What I'm trying to do right here, I'm trying to correlate between the cultural thing our parents told us and God and everybody, you don't do this, you don't do this, with medicine. I'm trying to give you an idea that medicine agrees with religion in this aspect. And we have to teach that to our children. Are you following me? Even what we have done ourselves is wrong, we don't have to have them do the same thing. I have friends, doctors, their kids, boys, I raised them more than they did. The kids come to my house, I teach them, don't drink alcohol, don't smoke cigarettes, don't do this, that's wrong to do that to a girl, that's wrong. I tell the kids that, where his father tells, no, don't tell him like that, he should do this, he should do that, and he gives the kid beer in front of me. That's the doctor. And when they have problems, tell them, we'll call Mohamed to help, to discipline you. The kids are big right now. They're married right now. Always, because I always sit down and tell them, that is wrong, that is right, that is wrong. The parents never done that. They said, oh, no, let them have fun. That's fun. No, that's not fun. The sexual part of your body is the only opening, besides the mouth, connected to the outside. Right or wrong? It is connected to the outside. A germ can travel through the penis, to the prostate, right or wrong, to the spermatic cord, right or wrong, to the testicle, right or wrong, and destroy it. Is that fair to that person or no? No. We have to help them. So if we have a prostate problem, we need to treat it. That's part of the impotency in men. If you have to urinate at night, if you have to wake up to have to go to the bathroom, the prostate is pinching the penis, you're not going to have erection. Because there's a swelling, there's a valve right there. So in the case like that, we treat the prostate, we put an implant, muscle sometimes in the penis, and new tissue we have to put in to get the man to function the rest of his life. We might have to do that in some people. To put a new muscle for them, plastic, with or without a pump. But before we go that route, I think we attempt, which my patient we have done that, we attempt to build the testosterone, build the circulation, build that, kill the infection in the prostate, and then many of them get better. If they don't get better, then I said, okay, your wife is healthy already, then let us fix you, let us have artificial muscle inside it, so you have your life together. We talk right now about the hormone problem in women. The reason I took that part of men first, actually it's supposed to be a women lecture, not male lecture, is because I'm going to have opportunity to talk to so many men right here for the first time, so I said, well, this is my chance to talk to them about that. Okay, women hormone, we can repeat it many times, and I tell you in my office all about it. One thing about women, they should never age. Because testosterone hormone in men is an aging hormone. Progesterone hormone and estrogen hormone, they're anti-aging hormones. But why we see women age? It's because their hormones are messed up in younger age. You look at a woman's body and the ovaries right here. They get messages from the brain, FSH, the same thing like the man does, and the ovaries secrete what? Estrogen and progesterone. And the adrenal gland sits right here, secretes testosterone. So women have three sexual hormones. Have estrogen, progesterone, and testosterone. Are you following me or no? That may be something new to some of you. That you are a female and you have a male hormone. You have to have a male hormone. And a male has to have a female hormone. Because if God left male with only testosterone, he would have carried a gun and killed everybody in his way. Testosterone hormone is an aggressive hormone. It's a destructive hormone. It's a muscular hormone. It's a vicious. It's a criminal hormone. It's a hormone that builds you up for fights, for survival, for this or that. But God does a little bit of a feminine hormone to hold you back for romantic feelings. The same thing with women. They have that. They have little bit of testosterone hormone for type A personality to go and get things done and get this, take care of the kids, wake them up, carry them, take them to school, do all that. That's all from the testosterone. If it was left up to estrogen, she'd be sleeping all day and having a good time. But testosterone, no. You wake up right now. You got to go here, you got to do this, you got to do that, you got to take care, and that's how we work together. So when we replace hormone for women, we have to pay attention to hormone number 1, hormone number 2, and hormone number 3 in the sexual part. But don't forget the other hormones that we talked about before, which I can find them right here someplace. Okay, those other hormones that we talked about for men, the adrenal, the thyroid, the parathyroid. We can't forget all of those things because they're going to produce heat, they're going to produce energy, they're going to produce muscle, they're going to produce good feelings like adrenaline, cortisol, make you euphoric, you know. Actually, I tell you what, something about hormones. I know a lot about hormones because I used to teach in medical school this stuff to medical doctors. So I have to convince them. For medical students, you have to be smarter than them to convince them to get respect. At least act smarter if you're not smarter. Okay. So anyway, because they are very smart, and they are going to ask you questions. So one of the things I want to impress one of the student, group of students with me in Chicago Medical School in Rush Presbyterian, we make a round, and we have a patient dying. Actually dying from cancer, dying from lung cancer, lost hope, almost in a coma. I told the students, there's not much we're going to do about that person. But I'm going to show you something right now to give that person some hormones to see the reaction to tonight. Come and see that same person tonight, see how they feel. I give them the adrenal hormones and all the adrenal hormones in the IV. Drip. They come back in the evening, the person sitting watching TV, giggling, laughing, making jokes. That's the same person who was in a coma. Unfortunately, I only can do that for a couple of days because the body itself is going down. And that's what happened. When I withdraw what I did, he died. So that is what the hormones does to you. Another thing, another patient of mine, he shot his own hormones intentionally. He shot his own adrenal hormone, pituitary hormone, intentionally he shot it. And I tried to get it to work, and it did not. And this is what happened. A person, I think he was about maybe 45, 48, something like that. was visiting the hospital, the VA hospital in Downey, Veteran Administration Hospital, and he had a broken toe. He came from McKinsey. We're the only VA in the area, so he had to come to us. I fixed his toe, but by that time we fixed it, we had a snowstorm. We had so much snow, there's no way he can get back to McKinsey in this road. So I told him, why don't you stay with us tonight? And I made a bed for him and everything. I told him, tomorrow you can go home. Simple broken toe, right? I get a call at 2 o'clock in the morning. And the worst thing you want to do is to get a call at night when you're a resident because you don't get much sleep anyway. And then I said, what's the matter? And then the nurse says, this guy in bed so-and-so thinks he's going to die. And he wants to fuck his wife. I said, gosh, wake me up for that? He's crazy. I said, have Dr. William look at him, the psychiatrist. I passed it to him. William comes and said, okay, call me. And I said, Nasr, this guy really thinks he's going to die. I said, you're kidding. What's wrong with him? Is he a psychopath or something? I said, what is the matter with you? He said, I feel I'm going to die, and I want to talk to her. I said, okay, get the phone, talk to her. She said, no, he's crazy. What do you mean he's going to die? He's fine. He's like a bull. Something happened to that man that night, shot all his glands. Because here's what I did. I did the EKG. I did the blood test. I did the blood gases. I did the chest x-ray. I did the EEG. I did everything from 2 to 5 in the morning, and he died in front of me, and everything was normal. Had cardiac arrest. All his arteries in the heart was unclogged, was clean as a whistle. Something I learned that day, when a person decides in their head they're going to die from anything, we have to revert him back to life. We have to force them to get back to normal life. We cannot let them go through that. It is not the right. Are you following me? Could be a depression. Just hit him or something. We should have given him a powerful antidepressant that night. We should have put him in IV or some psychotropic drug until he recovered. But I didn't know that can be done. And in front of me, he died. Slow down the heart flow until cardiac arrest. And then we did the CPR and it didn't come back. Autopsy, perfect. So that means the mind has a lot to do with our health. And when somebody is depressed, somebody not feeling good, we've got to pay attention to them. Kids especially. Because there is something wrong and we have to find it, we have to help them to go through it. You understand? Especially teenagers, when they come to you and there's a problem and they did everything bad in the house. Don't block them when they ask for help or you see they need it. Just go on their level and forget about all the hate you have against them and just be their friend and talk with them until you get them through. Then after they find, beat them up. Go back and say, you remember you did all of that. I got you. But don't let them get down to that stage. Because they will run away, they're going to seek help in drugs, they're going to seek help with the wrong person, and we don't want that. Take them and then be so patient until you go through that. Be the doctor, actually. These hormones, female hormones, they have one function. What do? They produce eggs to produce children, right? That is the main function or not? That is the main function of them. Main function for a woman is to get pregnant and have children. If she's unlucky, she has cancer or tumor, she couldn't, that's something out of her control. But she got everything, all the tools to produce. In the meantime, when she goes through life, and she goes through stages, when those hormones, here is the cycle, from 0 to 21 days, that's her cycle, she produces the egg at what day of the period she produces? About 14th? Okay. The 14th day of the period, the egg is produced. During that time, the estrogen and progesterone level, they exchange with each other to achieve that result. And by the age of 21 days, if there is nobody came in, that's a sperm, to make a baby for that egg, then the egg will come out, and then a new cycle starts again. You follow me? So actually, we consider women miracle. They are two persons in one. Women hormone is about 10 times more complex than men. Men have only testosterone hormone to produce a sperm, and he produces about 600 million of them in every cc. A woman has to concentrate on one all month to get it ready. And that one right here controlled by the estrogen and the progesterone hormones. So we know that. If the progesterone hormone stays low, then she develops in this time right here, what do we call PMS, premenstrual stress syndrome, because those hormones also supposed to make her feel better. So when there is a PMS, there is a problem in the relationship between the two hormone, estrogen to progesterone ratio. In the meantime, she's bleeding right here. There is a bleeding right here in that period, from the day 0 to day 7, right? All right, there's blood coming out. And that blood coming out has to come out of the body through the uterus. That blood to come out, what makes the blood come out easy? None of these hormones have anything to do with it. Thyroid hormone and adrenal hormone are the one who gets the period out of the body, not the female hormone. You follow me? So when a thyroid is low, she might have a regular period, she might doesn't have enough contraction to get the blood out, and you have the cramps, you have to investigate that problem. The estrogen and progesterone, they have other functions for a woman. Estrogen is the hormone God put it anti-aging hormone. Will not allow women to get old. That's estrogen. But in the meantime, it can cause, if it's too much, it can cause cancer of the breast. I'm talking about your natural estrogen can also cause cancer of the breast if it's too much. Then there is another hormone counter it called the progesterone. Progesterone will counter the excess side effect of the estrogen. Also, progesterone is the hormone of the libido, not the estrogen. Because it has to be a libido to have marriage and to have to propagate. We got to have some kind of attraction, at least to each other. So this is the function of the progesterone. So what do I mean by anti-aging hormone? It means when you reach the age that the ovaries dried up, they don't produce enough estrogen and progesterone, then what happens to that person? We look at this human body again, right here, and we find problems. We find that the estrogen that's supposed to put water, it's called water retention, but water in every cell in the skin is no longer there to keep water in the skin. So what happens to the skin? Starts aging, drying up, and wrinkles. Also, it's supposed to put calcium in the bone. So what happens to the bone? Develops aging, osteoporosis. And then if you don't help the bone, all you have to do as a 70-year-old woman or 75, walk and slip and fall on your hip, and what happens to it? It breaks. What do they do to it? They put a pin. But if the bone is empty of bone, with the pin take, will not take, will shatter again, right? So that's what I do to my female patients who lost their hips. They have hips, they shattered. What do I do to them? I put them in lots of estrogen, lots of nutrition, lots of that, until the bone itself is solid. Then I send them to surgery to reconstruct the femur again, and they do fine after it's shattered. But the most important thing here is to protect the hip before it's shattered. Do you know anybody, any female broke their hips, right? We all know. And if it cannot be fixed, where do they go? Nursing home. Somebody with a brain that's working fine, with the whole body working fine, wasting away in a nursing home. It's the saddest thing to see a human brain with all the talent and experience and the intellectuality sitting in a nursing home. Because even if that person have no body to function, he have a brain. So we can use him in the consultation of the society. We can use him to run centers. We can use them for kids. We can use them for many things because they got the brain. After all, our President Reagan was even older than that, and he ran the whole country. So age doesn't mean anything. Why it means so much for women to have to be a nursing home when a man can be a president? No. It is because doctors told him, you are in a change of life. I didn't know life would change. But you are born when you're young, my life is going to change. To what? Change to what? Well, you got life and death. You changing life to death? No, there's no such thing called the change of life. It's called, men made that title. When I started working with female patients about 15 years ago, I concentrated on their hormones. I said to myself, it is so easy to impress them. Get the hormones correct, they feel great, they think you're doing miracles. And that's what I did. But to get the hormone corrected, it's not easy. Because you're dealing with 7 hormones, and you know how much a gland secretes every day in the human body of a woman? The gland, like pituitary or ovary, secretes 1/10 of a drop every day of a hormone. So here I am going to get pills in huge quantity, and then I have to control by blood test, manage it with a blood test, and then we see the bone strong. No, 99% of my patients, female, at the age of 70, have no osteoporosis. None. And the proof is there in the clinic. Anybody can come, we show them the x-ray. And I told that to the medical association about nutrition, because I get lots of questions from the licensed board about why do you get vitamins? Why is nutrition stuff you give a lecture about? You're always talking about nutrition. I said, come and look at the charts. We have 15,000 patients. We have the healthiest, the best heart, the best bone, the best skin. We don't have anybody go to the hospital. We don't have open heart surgeries. We don't have problems. So that's not important. But why are you doing it? I had 6 doctors coming one time, and I said, we want to look at this. What's she doing? I said, okay, good. We have, you see those charts right there? Pick anyone, just tell and call the patient and do it. You got all there. Here's the key of the clinic. You can live here. So no. We just bothered about this thing about vitamins. I told them, I think you're stupid. And you get out. You know, I said, there were FBI, there were this, there was this, all this. I said, get out of here. You know, just to get out. You are all dumb. And I didn't hear from them. There's 2 years now I didn't hear. Maybe they're planning something. But it really doesn't matter, because I have no fear. As a Muslim, I only fear one thing, only God. I fear no human being. And that is the way we are. And And my patients, thanks God, they have the best result. They are the healthiest people, and that's what we do right here. Another thing that estrogen does, very important. When the estrogen is low on a woman, try to talk to somebody, because most of you are taking care of yourself. You're probably taking estrogen, vitamins, exercise. Yeah. See somebody who is not, and you see them more depressed. They can't concentrate. Their memory is going away. This is their brain problem. They cannot sleep at night. They're so hot. All of this is from the lack of estrogen. And maybe the estrogen they're taking from the doctor is the wrong dose or synthetic. Maybe they need natural estrogen. Maybe they take an estrogen right here. Maybe they take an estrogen, but no progesterone. Maybe they have too much of one and none of the other, because you got to have them both. Women always go in cycle like this all their life. And if we cycle them up to the age of 100, they're fine up to the age of 100. They don't have aging, the skin stays healthy, the bone stays healthy, the brain stays healthy, the heart stays healthy. What's wrong with that? The only complaint they have are their husbands. And this is why we added to the lecture today. Okay. This is the estrogen we talked about. And this is the progesterone. Can we give progesterone to somebody who had a hysterectomy? If you're the doctor, I'm a patient, and I had a hysterectomy, and everybody say only take estrogen if you had a hysterectomy, right? Would you give me progesterone or no? Yes, absolutely, because progesterone have other functions in the body besides just the sexual part of getting pregnant. It does control the blood pressure. It does control emotion. It does control libido. It does help sleep. It does remove depression. All this is progesterone. So why not? What's the side effect of progesterone? None. What's the side effect of estrogen? Well, if you take too much, you're going to have sore breasts. You're going to have more bleeding with the period. You're going to have more cramps. And we have to control that. You could have cancer from it if you are taking too much. This is why I tell my patient who take an estrogen, please get the blood checked level once a year. We don't want you to be in the range of cancer. We don't want you to be in the range of aging. We want to maintain you around 200 to 400 level all the time. Okay, let me see if I forgot any other hormones right here. Okay, the only other hormone I haven't talked about is the prolactin hormone. There's another hormone coming from the brain, and that is for mothers who want to have children or going to breastfeed babies. There is another hormone comes out of the mother gland called the prolactin. Prolactin is a milk-producing hormone. And you don't have to know much about that, because most of mothers have enough milk. If they don't have enough milk, we can check their prolactin or stimulate the prolactin secretion. However, the reason I mention that is because men have prolactin, they produce milk. Women have more prolactin, they produce more milk. The problem here is some drugs for high blood pressure produces more prolactin for men, and men have larger breasts and produce more milk, and the prolactin is anti-testosterone hormone. So women or men who are on high blood pressure medications, diuretics, hydrochlorothiazide, Ingrel, aldactone, Aldomet, spironolactone, reserpine, any of those, you got to be careful, because those are blocking all the male hormones and exaggerating the female hormones and making you grow breasts, and you don't have a chance to compete with women anyway. It doesn't matter how good you are. Okay, that's all I'm going to say tonight. I'm going to give you my phone number at my office at 708-356-9009, and the address is 213 South Milwaukee, Avenue in Lake Villa. The office is just across the border with Illinois, close to Antioch, Lake Villa, Illinois, 60046. Please, if you call that number and there is no answer, you call my other office if you have questions, and that's 708-843-8860. Right here, you talk to Dr. Fred. He's my assistant, and he can answer some of the questions, and if I'm not in town or something like that, he will be able to reach me and then tell you if there is any problem. But this is the address right here to write to. If you write me a letter and you don't put your phone number, I'm not going to answer it. I only answer by phone. I never answer by mail. Because when you write me all your problems, I need to talk to you to ask you more questions about yourself, and you didn't give me a chance. You're just telling me what you want me to say. I can't do that. So I have to call you back in the evening when I go home. I take your home number with me, and I call you at your house and tell you what's the problem. We can talk about it. I will take some questions from front to the back. Yes.
Two. One, you mentioned that ACTH rises a few hours, about 2 to 3 in the morning.
Mm-hmm.
Would that be a factor in someone that is constantly being woken up around 3 o'clock and they have no clue as to why they keep getting woken up? And they wake up totally refreshed, and an hour later they're tired?
Yeah. The problem right here, the people that go to sleep, they wake up and they can't go back to sleep, and they go back to sleep, they're tired. Usually the person who goes to sleep and wake up after 2-3 hours, there is a problem in their brain. Either stress or diabetes or low blood sugar or the room is too hot or something bothering that person, make him uncomfortable, he cannot sleep. If you have a dream, you're worrying about somebody who's having cancer and dying and you love him so much, you're not going to be able to sleep. Your brain is thinking all the time. So actually when you wake up, you did not sleep until 2 or 3 o'clock. You're still awake. You thought you slept and you didn't sleep. ACTH has nothing to do with that. ACTH is there all the time. It never went to sleep anyway. It's being produced all the time. And that creates exhaustion, creates mental depletion of dopamine. It creates mental depletion of dopamine, and ACTH also, it creates adrenal depletion of cortisol and adrenaline. And eventually that person who's worried about something else, he himself is the one who will develop allergies, infection, and cancer also. So what we have to do when we have somebody who has a problem in their life, if they trust my judgment, I put them to sleep, I give them a very strong sleeping pill, and that's over. For 2-3 days, and then I take it off, and they can handle it on their own. Because some people just can't take stress, and they stay awake all the time. Sleep is an important function of hormone management. If you don't have enough sleep, forget it. There is nothing going to work.
Okay, the other question was, women that get severe depression, right, as part of PMS, but major depression, where they're suicidal and they call their therapist and they're getting antidepressant pills, would that be better than they're looking progesterone?
The women who get so depressed, suicidal, the best approach for them is to work in combination with psychiatrists and internist, not with a therapist. A therapist is not going to do any good to that person. Therapists should work under a psychiatrist. You've got to correct the organic problems before the social problems. And sometimes we try to correct social problems, family problems, before organic problems, and that is dangerous. So the girl who is in her period and she having PMS and she's suicidal, I think there is something serious organically wrong with that person, because nobody want to commit suicide. Nobody in their mind should commit suicide. His life is worth everything living for. So there is something wrong. Could be stress-related not enough sleep. It could be dopamine adrenal depletion. It could be severe hormonal imbalance. It could be cardiac related. It could be lack of circulation. It could be metabolic imbalance such as all these hormones. It could be nutrition related such as calcium and potassium, magnesium imbalance. This is why we said it so many times in the lecture. The easiest way to do, go on a good vitamin program, your Shaklee program, your protein, carbohydrates, fat, vitamins, water, minerals. Do some exercise, and like I mentioned before, then if that doesn't work, go look for a doctor. And that's probably a good advice. Yes?
When a woman starts on estrogen and progesterone, can she ever get off of those two hormones?
When a woman starts on estrogen and progesterone, can she ever get off? No. These are natural parts of her body until she dies. And if she ever gets off it, that is part making her enjoy living. If she gets off it, she is going to revert. No, she should not. But we should monitor the level of that hormone. The amazing thing, Medicare patients, Medicare itself approves hormonal management. They pay for the test for hormone for all Medicare patients. Private insurance don't. Medicare does. So the good thing about the people in that age they need it the most, the government pays for it. So that's not going to be a problem. Until Clinton destroyed the country, then we have a problem. Okay. Yes. The question, how much calcium she should take to strengthen her bone. It depends how much you are missing. Some people don't absorb it. Some people don't have enough vitamin D to help the absorption. Remember, the calcium you take from outside does not get absorbed without vitamin D.
I'm taking calcium with vitamin D, calcium, magnesium, with vitamin D.
Women in general need about approximately between 18 to 24 tablets of calcium a day in that age. 18 to 24. And if you think that's too much, you weigh them. They're about 2,000 to 2,400 milligrams. This is only 2 grams. You only absorb 10% of calcium, by the way. The body never absorbs more than 10% of the calcium. Even healthy body doesn't absorb more than 10%. 90% of the calcium is wasted even in healthy children. Why God does it that way, go ahead and ask Him. But that is the way we see it. He will not allow all the calcium to be absorbed for a reason. So this is why we have to have so much milk, so much cheese, so much calcium, so much of that, because not all of it gets absorbed.
How about alfalfa? About taking 10 a day?
Alfalfa 10 a day, I think it's a very low dose. I raise horses in Antioch, Illinois, and if I give my horses 10 alfalfa tablets a day, they get very upset, And because they said, if you want me to act like a horse, I need more alfalfa. So we give them bales. We're not asking that from you. We're asking about probably 30 or 40 tablets of alfalfa a day, yes. Any other questions? Yes, ma'am. I really think that the women who do not have hot flashes when they have low estrogen are more trouble than women who have hot flashes. That reminds me by men or women who have a chest pain with a heart attack and the one who don't have a chest pain with a heart attack. I think they're all alarmed in the body to tell us something is wrong. One of them is the hot flashes. Or chest pain with a heart attack. When you have a heart attack and you have no pain, you are one of those unfortunate people your alarm is being shut off. And the hot flashes is the same thing. I have lots of patients, I don't have hot flashes. Why should I need it? You're going to have to explain to all the people this. Diseases exist in the subclinical stage right here. They're getting old with time. Cancer is developing. Blocked arteries are developing, infections are developing, it will hit the person one day. to counter it, this area here, get a checkup, good nutrition, good exercise, take care of yourself, you have less problem up here. But if you ignore it here, you have more problem up here. Are you following me or not? You remember that from the beginning of the lecture. You can't fight with people who said, I feel good. If they feel good, tell them, okay, when you feel bad, come and see me. You know, that's another choice. You know, there is no time for us to waste on somebody who does not want to help themselves. If they want to help themselves, they don't want to have an open mind, they don't want to stop smoking and alcohol and eating better food and doing exercise. You know, I didn't do it especially for you now. No, all of these things, then I tell the person, well, that's your health, not mine. And when you die, I'm not going to even remember you. Because we don't remember the person who dies anyway. We feel sad for them for about a year or two, but life continues, right or wrong. You know, who's the loser? The person who died is the loser. We're not losers. So don't go out of your way try to convince people to try to take care of them. My kids, I have 2 teenager daughters. I used to tell them that. You want to drink the Pepsi, the Coke, you have cancer, that's your problem. This is the right, this is the wrong. This is the right path, this is the wrong path. And teenagers, sometimes they find the right and the wrong all the time, you know. Then when they get sick, we remind them. That's what you have done to yourself. So, correct it. I just added extra information to your question. That's not what you have asked. Yes?
Are you saying that a person with onset of menopause, if they first have hot flashes and then they stop, you're saying their body is shutting down, but that they should be on estrogen?
Absolutely.
In general?
That's part of you. It is not a drug. It's not an aspirin. Thyroid, adrenal, ovary, testicle. They are part of the integrity of the body. We didn't even talk about the pancreas and the insulin and the other glands. We didn't have time for that. But those are the things that God put in us to enjoy living. And if you want to take one of them off, that is your decision.
Well, what if you're enjoying living because the hot flashes stop?
You're not enjoying living. There is no way you can be. Because the body is going down. Because the aging of the skin is occurring, the aging of the heart is occurring, the aging of the bone is occurring, the aging of the vagina is occurring, the aging of the romance is going away, and the sleep is going worse. What kind of enjoyment? It's artificial enjoyment. It is we enjoy going out and have a period and all of this. No. The main enjoyment you want to have is from within. The looks is deceiving to all of us. We look at people and say, oh, he looks so happy. He looks so healthy. She looks so healthy. No. Are they really healthy and happy inside or not? And many of us, we don't want to bother anybody. We keep things inside and we act with a big smile. I'm fine. Inside, we're not fine. We have problems. So what I'm saying right here, we got to work in the long goal, not the short goal. We have to have a long sight ahead. Because you're young, you don't feel anything. But let us see 10 years from now. I tell my patients who don't take hormones, I said, take your picture today. Take your picture again in 5 years. And I bet you're gonna age 10 years in 5 years. And 20 years in 10 years. And 30 years and 15 years. Take your picture. And also ask other people who have been taking care of themselves. They can be 70 and they look like 50. They can be 60 look like 40. There is 20 years of age difference right here. And then look at the stature, how they stand up. Are they standing straight or they going forward? All of these things are important. You think a person walking like this is enjoying themselves? No. That is what's going to happen to you. So we're not going to be like people who ignore everything. Oh, it's not going to happen to me. It's not going to happen to me. It's happening. No. it will happen to all of us. And this is the whole idea of preventive mental lectures like this, is to make you aware you're not invulnerable, invincible. You're going to get hit by your problems, and you better do something about it. Yes?
You said here that if you get too much estrogen, you can get cancer of the breast. And if there is a problem of cancer of the breast in your family, shouldn't you be concerned about taking estrogen?
No. If there is a problem with cancer of the breast in the family, you still take estrogen. And if you have cancer of the breast yourself, you cannot take estrogen. But I'm going to tell you something else about that. Our patient with cancer of the breast, they have cancer of the breast, we had to put them back on estrogen. Even there is a risk of the cancer coming back, we still have to put them on estrogen. You see, this is a risky practice as a physician to try to put somebody on estrogen, they have cancer and they sue you. No, because that person, we find out that the bone is drying out, the osteoporosis, they're about to break their hips, the heart is getting enlarged, the blood pressure is going up, the arteriosclerosis, everything is going downhill. Then we sit down and said, what direction we should do now? Should we worry about the cancer? Should we correct it? So what we do in that case, we give the estrogen, but we monitor the cancer. There are blood tests we have in my office to predict cancer a year ahead before it shows in a mammogram. There is blood tests we can do to predict the cancer of the breast, the colon, the ovary, the lung, about a year before even you see it on an X-ray. There is also immune study we can see how strong your immune system is getting, stuff like that. But you can't sacrifice the quality of life for the fear. No. Cancer is not inherited, like they say. If your sister has cancer, your mother, everybody, it doesn't mean you're going to have cancer. Probably the reason the whole family have cancer because they all live in one area, they have the same polluted air, the same polluted water, the same polluted life, they all have cancer. I don't think it has anything to do with mother giving it to her daughter. I think it is environmental, but we don't have the courage as a government to face that. We have such a dishonest people in our government. They sacrifice human life for their politics. For example, when we had the nuclear bomb developed, and in New Mexico, in the White Sand, we exploded our first bomb. So we can kill the Japanese and the Germans and all of that stuff. Who do we sacrifice? When Mr. Truman himself stood far away, they blew the bomb. They had the soldier run under the bomb to collect samples. There was no cover. There was nothing in their skin at all. We didn't think that they're going to have cancer. They all soldiers died from leukemia. Every single one died from leukemia. Not only that, the president himself was in the room in Chicago when they were experimenting with the bomb, and they didn't know how serious it is. And the guy was going like this. He had the uranium in his hand, and he told Mr. President, when we put it through this coil, we see a spark. I think there is some radiation there. This can kill human beings. And he takes it, he puts it again. Look at the spark. He didn't know that the ball is expanding in his hand. And he's holding it in his hand, okay? The ball got stuck because it was gone, and the whole thing blew up. And about 7 scientists got killed that day and the president was not injured. And they knew radiation killed that day. So what happened when the New Mexico, when they made the big bombs over the ground, the wind was going toward Colorado. They didn't think this wind was going to affect the farmers and the people in this area. And when the corridor of Colorado had more cancer, more leukemia, more lymphoma, more that or that, everybody denied it has anything to do with nuclear action. What can we do when we are killing our own self? We're not killing other people outside. The governor of California just recently, California needed money, they have bad economy. He agreed to allow a ditch in California by the Colorado River to dump all the nuclear waste the United States have in California so they can get more money. And I work with the Sierra Club there to fight that. So far, we have lost. But they're going to dump your trucks full of nuclear waste, dump it in the desert, like this, just in the open. Who are we killing? This is not Mexicans, this is not Europeans, this is not immigrants. We are destroying our future generation ourselves. So we really have to be smarter, and we have to look ahead, and that's what nutrition we do in food nutrition. If we feed our body, feed our children, we produce healthier society. But we also have to fight pollution. We have to fight those companies who want to make the fast buck to kill millions. And that is in the hand of the citizens of this country. Yes?
We're talking about hormones anyway. I'm concerned about PCA. What do you have to say about that?
What do you mean, PGH? Oh, the bovine growth, the one we're going to put in the meat, you mean? Well, I will not eat that meat. For the milk, I will not drink that milk. Why? Then it's going to be tough. I don't know what to say. It's out of my control. I probably will have. I will stock powdered milk from now on. Soy milk. I go to soy milk. When we boycott them enough, they're not going to have anybody to sell to anyway. So that's a good one. Good way.